Good morning. Myself Varun Kumar, faculty, SNS College of Physiotherapy. Today we will see about the topic called disability evaluation. So evaluation means we have to assess. So what we are going to assess? Disability. So introduction. So disability evaluation is a systemic medical and functional assessment which is used to determine the existence, extent, and impact of an impairment on a person's life or their work or social functioning. So which is the patient will have a different type of existence, a different type of extent, and they can't able to go with their personal life because of the impairment. So what will be the principles of disability evaluation? So initially, objective and standardized assessment needs for the evaluation purpose of the disability. Then we can need to assess should be the reliable and valid format, and then we have to evaluate the person physical, psychological, and social aspects, and also we need to focus on their functional independence, and then we need to go with the periodic reassessment which is essential for the patient. So what will be the components of disability evaluation? So usually we need to start with the history taking, then physical examination of the patient. So in physical examination, there will be a different form of physical examination. And then in functional assessment, in the functional assessment, we can able to assess the person's whether they are dependent on others in their functional task or they are go with the independence of their functional activities by themselves. Then psychological assessment. In psychological assessment, we need to go with the mental health of the patient. In vocational assessment, whether the patient is capable to go with their workplace atmosphere, and then we need to go with the environmental assessment. So these are the various components of the evaluation of a person with disability. So in history taking, we start with the chief complaint, duration, past and the surgical history, functional difficulties, their occupational history, social and family support, and then whether they are using the assistive devices or not. In physical examination, we can go with the posture gait assessment, range of motion assessment, muscle strength testing, tone and reflex examination, sensory examination, and then the coordination and balance evaluation. In the functional activities, we can go with the ATL, whether the patient going with the instrument assisted ADL, mobility and transfer of self or patient attenders, then self-care abilities of their own activities like grooming, dressing, eating, etc. And then we have to evaluate the communication and cognition of the patient. So there are the different common functional scales which are useful to go with the evaluation of the disability. So these are the some basic things. So we can go with the Barthel index, functional independence measurement tool, modified ranking scale, and also Osworthy disability scale, and a visual analog scale for their pain. So disability evaluation in neurological condition. In neurological condition, we need to go with the disability evaluation for the different conditions like the stroke, spinal cord injury, cerebral palsy, Parkinsonism patients, any form of peripheral nerve lesions patient, and every assessment should be focuses on the mobility and independence of the patient, so that whether the patient is disabled or not. After knowing this thing only. So in disability evaluation in the orthopedic conditions such as fractures, amputation, arthritis, deformities, joint replacement, assessment of the range of motion, muscle strength, and the gait of the patient, evaluation of the pain and functional capacity of the individual. In cardiorespiratory disability evaluation, we can check with the exercise tolerance testing of the patient, dyspnea assessment, whether the patient having the breathing difficulty in either any form of activity or either in at the rest or during any activities or during any functional task. Then chest expansion measurement, pulmonary function test, and assessment of the endurance and aerial performance. So after knowing this, whether the patient is cardiacally fit or not. In pediatric disability evaluation, we need to go with the developmental milestone, gross and fine motor skills of the in children, cerebral palsy assessment, the school participation, and family-centered evaluation. In vocational evaluation, we need to assess of the work capacity, job analysis, ergonomic consideration, need for the workplace modification, pre-vocational training, and counseling if needed. So assistive devices which are used are wheelchairs, walker, crutches, cranes, orthotic and prosthetic devices, architectural barrier assessment needed, and modification of the home and workplace of the architectural barriers, and then the accessibility evaluation of the patient. So role of physiotherapist which involves assessment and documentation of the person goal setting and rehabilitation planning of the patient with disability, prescription of the exercise and mobility training according to the patient needed, patient and caregiver education, and then outcome evaluation and the follow-up so that we can change or progress the treatment purpose. So this is the mind map which shows the exact disability evaluation needed for assessment and also for the rehabilitation purpose. Thank you.